Priority Access Clinic is one of the great tools in the Reset package, and we've recently updated it to make it even better and more flexible for you. No more using the OneNote document. Everything for PAC can now be easily done in AHLTA. These priority access appointments have a really great role to play. We want to share with you the why and the how. First, let's make it clear that this is not open access. This is team-vetted, flexible, added access. The Priority Access Clinic's goal is to act as a buffer for demand fluctuations week to week, and to act as a pop-off for virtual demand if necessary. This is also a way that provider teams can increase their procedures without taking a hit on their percent open or face-to-face access. It puts the provider team in charge of their day and allows us to give patients care when they need it. PAC gives you a way to put patients on your schedule for walk-ins or as a catch-all for any virtual encounters that you deem need an added physical exam. Your template will have one group visit added to it every day that you were in clinic. You can add up to 15 appointments to this one time slot, and they won't take away from your access reports or percent open. The PAC group visits is at a fixed time on the schedule, but you will annotate the time that the patient is coming in the reason for visit. Having this one group appointment on the schedule every day you are in clinic allows the team to decide how or if they want or need to use them on a given day. They can use them every day here and there, or they can still batch their PAC on a particular day. Or they can mix that up even week to week. Some weeks your access may be so good and you may be so on top of your patient care that you don't need to book any PAC appointments. Flexibility and ownership. That is the Reset way. If you want to schedule someone to pop in the next couple of days, you'll want a way to track that, and you'll want it to be visible to everyone in the EMR. The goal of these visits are to meet needs that are anticipated to be straightforward and quick, and this fills a gap between shorter virtual encounters and the lengthier traditional face-to-face encounter. Occasionally, while conducting a virtual encounter, you may realize that you need to bring the patient in for an added physical exam. This gives you a great way to bring them in and add to that note. If you bring them in later, what you would do is you would close that virtual encounter as normal. And then you would copy that note into the face-to-face exam when they come in for priority access and simply add the part that you need. This eliminates any need for double documenting. The group PAC appointment will be web excluded and provider book only, and providers may choose what time works best for the team and the patients. This is to ensure that providers and teams are the only ones who may book into these slots on an as-needed basis. The group appointment slot will act as a placeholder. However, provider teams may work with patients so that patients may arrive at a particular time. Once a nurse, tech, or provider deems that a patient is appropriate for PAC, they'll book them into the group appointment on the day that they've agreed on for them to come in. The reason for visit should start with an exclamation point, followed by the time agreed upon by the provider, staff, and the patient, what time they'll be coming in, followed by the chief complaint. In this way, sorting the appointment by reason for visit will stack all group appointments on a given day, and then also stack within group appointments so that the times line up. On that priority access day, the patients will show up at the front desk and be checked in, just like any other appointment. Let's take a look at the check-in sheet. It doesn't ask them to rewrite their entire medical history. It asks for relevant recent changes. In fact, we try not to ask patients things that are already in their record because we find that annoying when we go to the doctor ourselves. The recent symptoms field exactly mirrors the common review of symptoms field in the AHLTA core template. HPI questions are easy, and there's a section at the bottom candidly asking about profile concerns. Remember that PAC is a unique tool to meet a unique type of need. Reset is all about empowering you to use different tools in their respectively appropriate situations to enable you and your team to take complete ownership and have flexibility and autonomy in meeting your patient's needs. Without worrying about using up your available appointments or lowering your percent open by scheduling quick visits, quick exam, procedures, and anything else that you decide best to take care of your patients and your team. Reset is about improving staff satisfaction and access, knowing that when you improve those, patient satisfaction and metrics will soar. PAC. One more reset tool to help us all put passion back into practice.